Hi, my name is Patricia Shinondo. I'm a pediatric surgeon. So I find that what's so cardinal that we've learned in this time of COVID-19 is really the mental health aspect of well-being. And I suppose as caregivers, what I find so important and cardinal is that we need to prioritize our well-being, our mental well-being, so we can give an all-round better approach to caring for others. So we as caregivers need to take care of ourselves first. And that's now one of the things I say the most, that if you're a caregiver, take care of yourself, and then you can give your best to take care of others. So really, in my talking to people, in my discussions with people, I find it's important for us to highlight that aspect of a caregiver. Many a times we're just known as caregivers, as though we ourselves don't need care. So I really wanted to start with that point. So being a pediatric surgeon, my heart is all about safety for children's surgery. And in COVID-19, we've had to pull back. We've had to adjust, to change our way of working. And so what is for sure is that down the road, post-pandemic or whatever phrase we want to use, we do need to be very aware that there is a long road ahead of us, that there's a lot of work to be done, especially in low and middle income countries like mine, Zambia. We now have health systems that are constrained beyond belief even most times. So we need to be aware that we need to start thinking right now of solutions to fix tomorrow's problem. The pandemic will open wide all other aspects of other diseases and other burdens that children face. I will keep referring to children because that's where my heart and my joy is, in pediatric surgery. So offering safe and effective children's surgery is my passion. So we need to find a way in low and middle income countries to fix that uphill climb that we're going to face. How do we catch up? How do we meet these children at their point of need? And so that's something that I really think is important to think about. In doing that, we can start putting our minds around data. What do we know so far? What have we learned during this time to fix tomorrow's problem? I'm a huge advocate of research and data collection, which again in LIMICs, low and middle income countries, isn't our strong point. We don't write our own stories. And that's another thing I would like to do more of, and sort of change tomorrow's perception of scientists from low to middle income countries. It's not something ingrained in us, and it's not something we prioritize as nations for many reasons we won't go into right now. But I do believe that those of us interested, those of us that are keen to tell our own stories, for lack of a better word, and work on research and data collection to see what's happening in our parts of the world. How can we change what's happening in our parts of the world in our resource-constrained settings? And so I'll just leave us with that. I really think we need to start to tell our own stories, and that's how we collect data to better inform decisions that are made to influence tomorrow. And by influence tomorrow, I mean in the post-COVID recovery or in life after the waves of COVID. Once we try to recover from the immense pressure and trauma that it's caused us, how do we now get back to helping the children that will need the surgical help out there? Data can help us do that. And so I think we need to learn to tell our own stories. Definitely with the help of collaborative efforts from our friends in high-income countries, but not so much to let them lead the storytelling, but we need to lead the storytelling on our own. And so that's a bit of who I am and where my heart lies. And I would love to share with so many more people that think the same way I do. Thanks.